Recording in progress.
Okay. Do you know what is COPD? COPD is a chronic obstructive pulmonary disease. From the word itself, we know that it is a obstruction. Okay, it is a obstructive disease. Where it is obstructing, it is obstructing the pulmonary tract. That means it is the respiratory tract obstructive disease that is termed as the COPD. The main conditions involved in COPD are chronic bronchitis and emphysema. Okay, chronic bronchitis means it is a alveolar inflammation. That means due to some exposure to allergens. Okay, some, for example, some dust or some pollen, whatever, some means anything, any allergic factor is there. If the person is exposed to such stimuli, the airway become inflamed. Okay, when the airway got inflammation, what will happen? There is a production of mucus. Because of the response of the inflammation, some inflammatory changes can happen. Okay, and this inflammation can lead to the production of the exudate or the production of the mucus. That is the first condition involved in the chronic bronchitis. And the other condition which is involved in the COPD is emphysema. In emphysema, there is a alveolar damage. That means we know the respiratory tract. See, this is the trachea and it is moving with the bronchus, then bronchioles, finally alveoli. Okay, this is the normal respiratory tract. Here we can see the alveoli. The color we can see some tubular like goblet size structures. Okay, grape like structures, that is the alveoli. And the main gaseous exchange, that means the exchange of the oxygen and exchange of the carbon dioxide. We are inhaling oxygen and we are exhaling carbon dioxide. Okay, so to maintain the homeostasis, the oxygen and carbon dioxide needs to be exchanged. Okay, that is called the oxygenation or gaseous exchange. And this gaseous exchange is most commonly taking place in the alveolar spaces, and this is the one mainly involved in the gaseous exchange, that means the alveoli. When there is a inflammation in the alveoli, what will happen? There is a production of the mucus. Okay, and the emphysema means the alveolar damage. The particular damage we can lead to the obstruction of the respiratory tract, that is emphysema. So I am saying it is a natural theory only. I am not going into too detail. What will happen when there is obstruction lead to the respiratory tract, which can lead to, what will happen when there is obstruction, which can lead to narrowing of the bronchus, that is bronchospasm. Okay, when there is a bronchospasm, the air travel through the respiratory tract is get interrupted. So the oxygen inhalation and exhalation of the carbon dioxide get interrupted. Okay, so we can see it can lead to what when there is a acute inflammation, if it is left untreated, and it can cause permanent changes in the alveoli. Okay, that is called the chronic inflammation. When there is a chronic inflammation, what will happen? The airway get narrowed because of this inflammation, as well as there is a excess production of the mucus can happen. See the picture here. See, this is the normal respiratory tract. Can through the nose the oxygen is inhaled and it is traveled through the upper respiratory tract, then travels into the lower respiratory tract. Okay, so here it is a healthy bronchus. Healthy bronchus means there is no obstruction in the respiratory tract. But when there is a chronic bronchitis, okay, bronchitis, itis means inflammation. Bronchitis means inflammation in the bronchus. So when there is a chronic bronchitis, what will happen? See the picture here. The space, the alveolar space or the space between the respiratory tract will get obstructed because of the inflammation. So also this respiratory tract, the air entry get trapped because of the mucus also. In the second picture, we can see the bronchus which is get inflamed and which is accumulated with the mucus. Okay, so this is chronic bronchitis. When there is a chronic bronchitis happen, what will happen? The air got trapped in the alveolar space. Okay, which can lead to emphysema. That means some rupture of the alveolar membrane can happen. Okay, that will affect the air travel through the respiratory tract. These are the main thing happen in the COPD. Bronchitis as well as emphysema. Bronchitis, inflammation happens Due to the inflammation, the air travel through the respiratory tract or bronchus get interrupted, which can lead to trapping of the air in between the alveolar spaces, which can lead to emphysema. This is the basic changes which is happen in the bronchus and the alveoli in case of COPD. Okay. So what will happen when there is an emphysema? The air got trapped in between the alveolar spaces, which will affect the elasticity of the alveoli. That means the recoiling of the elastic recoiling ability of the alveolar get interrupted. What will happen? When the elasticity lost, what will happen? The air entry or air travel through the alveolar space got interrupted. What the excess carbon dioxide is trapped in between the lung capillaries, and also the client will get what inadequate oxygen inhalation. The oxygen will not reach into the alveolar space properly. At the same time, the carbon dioxide is not eliminated from the alveolar space in a normal way. The carbon dioxide gets trapped in the alveolar space, and there is a lack of oxygen supply or a lack of gaseous exchanges taking place. Okay. So that means there is a decreased oxygen and there is a increased carbon dioxide. Understood how it happened? That is mainly because of the bronchospasm. How the bronchospasm has happened? Because of the inflammation. Okay, what are the conditions involved in the COPD? Chronic bronchitis as well as emphysema. Understood the pathophysiology? Anyone have any doubt on this? About this COPD pathophysiology? First, there is a inflammation, exposure to the particular stimuli or allergen, which can lead to what inflammatory changes in the alveoli, that is bronchitis, and which can lead to the inadequate air exchange through the alveolar spaces, which happen in the emphysema. So that will lead to the loss of the elasticity and can lead to the trapping of the air in between the alveolar spaces. And finally, what will happen? There is accumulation of the carbon dioxide. The lung get hyperinflated. Hyperinflated means there is the space between the alveolar space get widened. So lung is hyperinflated means the space is get widened. Okay, so that means carbon dioxide is accumulated in the alveolar spaces, which can lead to inadequate gas exchange. That means decreased oxygen and increased carbon dioxide. Okay. What will happen when there is a decreased oxygen and increased carbon dioxide, which can lead to respiratory acidosis. Okay, how the respiratory acidosis happen? In the ABG we already learned everything. Okay, the main three parameters involved in the ABG analysis are the pH, partial pressure of the carbon dioxide and bicarbonate. These are the main three parameters which determines our acid-base balance in our body. Okay. When there is a low pH, normal pH is 7.35 to 7.45. Okay. And normal partial pressure of the carbon dioxide is 45 to 35 mm of Hg. Normal bicarbonate level in our blood is 22 to 26 milliequivalent per liter. Okay. These are the normal values. When there is a decreased pH, okay, two abnormal conditions are there: acidosis and alkalosis. Already we have taken detail in the class. However, I will just give an idea. When there is a low pH, it can cause acidosis. When there is a high pH greater than 7.5, that is alkalosis. Okay. And partial pressure of carbon dioxide, normal value is 45 to 35. And when there is a increased partial pressure of the carbon dioxide, what will happen? See the picture itself. Only that means the pH and bicarbonate are moving in the same way. Only one is traveling in the opposite way, that is carbon dioxide. That means when there is pH is low, that is called acidosis, and when the bicarbonate is low, that is called acidosis. Okay. And when the pH is higher, it is called alkalosis, and also when the bicarbonate level is higher, that is alkalosis. But in case of partial pressure of carbon dioxide, when there is a increased carbon dioxide, that means the lung get hyperinflated because of the accumulation of the carbon dioxide. So that condition is called acidosis. And when there is a decreased partial pressure of carbon dioxide, that condition is called alkalosis. We have to compare with the respiratory system. Okay, so the normal values are same only in all the system, but while coming to respiratory conditions, we have to look for the carbon dioxide and the pH to determine whether it is alkalosis or acidosis. But if it is related to any urinary system or any fluid level system, we have to look for the bicarbonate level. Okay, that means this bicarbonate is eliminated through the urinary system. When there is a bicarbonate accumulation, that is alkalosis. When there is a decreased bicarbonate, that is acidosis. Okay, but here in respiratory conditions, always we look for a carbon dioxide as well as the pH. When there is a pH increases, that is alkalosis. Okay, when the pH decreases less than 7.35, acidosis. At the same time, what will happen in case of the carbon dioxide? When there is a increased carbon dioxide, that is acidosis. When there is a decreased carbon dioxide, that is alkalosis. Understood about the normal pH analysis? Anyone have any doubt? Can you please repeat, anyone? Those who have any doubt. Teacher, can you please repeat about the ABG analysis? What is the normal values and what is acidosis and what is alkalosis? This is very important question asking area. Anyone, please? Teacher, are you able to speak now?
Of course, I'm at work, but I'll try to speak.
Okay, no issue, no problem. Rachimol,
Oh,
okay, no issue. Rachimol, are you able to speak now?
I can speak.
If you are able to speak, you can speak, because I want to means make it clarify whether you have understood or not. That's only. Okay. Can you please just
Okay.
acidosis, alkalosis, what are the normal values? Others, please listen, because while moving to the question, it is very important. That's why. Okay.
All right. So for the pH, anything above 7.45 is alkalotic,
Yes.
and anything below that is acidic.
Yes.
So when we want to understand the acidic or the alkalotic of the pH, we first check with the level of the pH. For example, if the pH is below 7.5, 7.35, then it means it is acidic. Then we go on to check with the bicarbonate, and usually when the pH is low, the bicarbonate also is supposed to be low.
Yes.
So for the normal bicarbonate, it's between 22, is it 22 to 26?
Yes.
So when it's below the normal,
Yes.
then it means it will be acidic as well. So it will be metabolic acidosis.
Okay. What about in
And then
case of carbon dioxide?
usually when the pH is low on the acidic side, and when it's respiratory acidosis,
Yes.
the pH of the carbon dioxide will be elevated.
Not pH of carbon dioxide. It is partial pressure
So
of the carbon dioxide.
partial pressure of the carbon dioxide will
Yes.
be
Yes.
elevated, of which the normal carbon dioxide is supposed to be 35 to 45.
Yes.
So which means in case of partial pressure of carbon dioxide being above 45, then it means it's acidic.
Yes. Okay. If it is greater than 45, it is acidic. If it is less than 35, it is alkalotic. Okay. And we can differentiate respiratory and renal. How? If it is related to the abnormal values related to the partial pressure of the carbon dioxide, it is respiratory. That means high partial pressure of carbon dioxide is acidosis, and low partial pressure of carbon dioxide is alkalotic. Okay. And while in case of the metabolic, we can look for the bicarbonate. Okay, if it is low bicarbonate, it is acidotic. If it is a high bicarbonate, it is alkalotic. Okay, like that we can differentiate. You see the wrong method, that means here this pH and bicarbonate move on the same way. The only opposite one is which one? This one, carbon dioxide only. Okay. Respiratory opposite metabolic, that is the main. Metabolic equal, that means bicarbonate and pH. Okay, pH is the metabolic one, carbon dioxide is the respiratory one. Okay, ROM means respiratory opposite metabolic equal, that means only one which is moves in opposite way, carbon dioxide only. You always think about the only means when the carbon dioxide level increases, acidosis. When the carbon dioxide level decreases, it is alkalosis. But when the pH increases, acidosis, when the pH decreases, acidosis, and the bicarbonate decreases less than 22, it is acidosis. When the pH increases greater than 7.5, it is alkalosis. When the bicarbonate increases greater than 26 milliequivalent per liter, it is alkalosis. That is the basic analysis of the pH. Okay, they will ask question by giving the values. We need to identify whether it is respiratory alkalosis or acidosis. We need to identify whether it is metabolic acidosis or alkalosis. To find out that, we should know about the, they will give the normal value. However, if it is better to memorize these values. Okay, always we can differentiate. By seeing the carbon dioxide value, we can see the respiratory. By seeing the bicarbonate, we can differentiate with the metabolic or renal acidosis. Okay, these are the, so in case of COPD, what will happen? There is a retention of the carbon dioxide. So what will happen for the patient? The patient will get respiratory acidosis. Understood how the respiratory acidosis occurs? Because of the accumulation of the carbon dioxide in between the alveolar capillaries, which can lead to excess carbon dioxide level. Finally, the client will develop respiratory acidosis. Okay. So at the same time, there is decreased oxygen supply to the lower respiratory tract or the alveolar space. When there is a lack of oxygen supply, the patient will struggle to breathe. That means there is a work of breathing get increases. The patient will struggle to breathe. To get more oxygen, the client will struggle to breathe. So the work of breathing get increases. At the same time, we can see the effort kind of, we can assess the patient that the client is struggling to breathe, and also the client is using intercostal muscles for the breathing. Okay, that means that is because of the workload of the breathing get increases because of hypoxia. How the work of breathing increases? That is because of the deficient intake of oxygen or deficient supply of the oxygen to the alveolar space or inadequate gaseous exchange. Okay. Next, we can move on to the complications. Finally, if the client is having COPD and the client is not taking treatment properly or non-adherence with the medications, the client can lead into what will happen? Respiratory failure. Okay, first thing, respiratory failure. Second thing, pneumonia. That means pneumonia is a inflammation. Okay, here also in COPD, chronic bronchitis is the basic lung disease involved in the COPD. So this inflammation can lead to excess mucus production. Finally, client can experience bacterial overgrowth can cause pneumonia in the patient. Okay. Last one, cor pulmonale. Cor pulmonale, how can right ventricular hypertrophy? Because of because from the right ventricle, the blood is travel into the through the pulmonary artery into the lungs. In the lungs only the gaseous exchange is taking place. But when there is inadequate gaseous exchange, what will happen? The blood will backflow into the right ventricle. We know the circulation already, okay, which can lead to accumulation of the blood in the right ventricle, can lead to cor pulmonale or right ventricular hypertrophy or respiratory failure only. Okay. What are the clinical manifestations involved in the COPD is dyspnea, chronic productive cough. Why productive cough? There is a excess mucus production can happen which can lead to productive cough. That means there are two types of cough. productive and non-productive. Okay, productive means there is a presence of mucus or secretions. Non-productive means dry cough. There is only cough, there is no secretions. Here in case of COPD, there is a productive cough is there. Okay. Next, because of the secretions or mucus accumulated in the alveolar spaces, the client on auscultation, we can hear the wheezing sound. Okay, music whistling sound, that is wheezing. Barrel chest. Barrel chest means the anteroposterior diameter and the transverse diameter get equals. Okay, in case of COPD, because of the lung inflation. Here, hyperinflated lung can cause barrel chest in the patient. And tripod position means the client will sit upright by resting the hands, so that the lung space get expanded and the client work of breathing get controlled. For that, for the easy breathing, client will select the tripod position. And also pursed lip breathing, that means the client will make the lips into pursed lip, so that the more oxygen can enter. The client will try to inhale more oxygen. Okay, that is pursed lip breathing. And if the gaseous exchange is not taking place adequately, there is, because of the hypoxia, client will develop cyanosis. Cyanosis means bluish discoloration of the skin. Okay, that is because of the deficient supply of the oxygen, client will develop cyanosis. That will come in the later sign only. Initially, the progressive symptom is dyspnea, chronic productive cough, wheezing, barrel chest, tripod position, pursed lip breathing, and finally pursed lip. This cyanosis can happen. Okay, what are the diagnostic one? One is spirometry. Spirometry, we can assess the inhalation and expiration capacity of the patient. Okay, that means expiratory volume and inspiratory volume can be checked in the patient. Okay, that means we will ask the patient to take a long deep breath, so that the balls in the spirometer get elevated. Okay, if the client lung capacity is too difficult to hold the breath, what will happen? The client can't do the spirometry properly. Second one, ABG. ABG, we need to rule out for the respiratory acidosis. That means we should look for the ABG values, that is pH, PaCO2 and the bicarbonate level, and we can rule out the respiratory acidosis. That means here respiratory acidosis, what will happen? pH will be decreases, at the same time carbon dioxide will get increases, and the bicarbonate level remains equal or normal. Okay. Chest X-ray, we can see the hyperinflated lung. The lung get hyperinflated, and also we can do the sputum culture. Why we need to do sputum culture means because of the excess mucus production, and because of the excess mucus accumulation of the alveolar spaces, what will happen? It can lead to overgrowth of the bacteria. So, if there is bacterial presence, we can rule out with the sputum culture. Okay. So, management mainly focusing on what? First one, acute exacerbation means that is the emergency one. We need to provide high Fowler's position. We can administer 1 to 2 liter per minute oxygen, oxygen only. That means here we can't administer a high volume of oxygen. Already the client is hypercapnic. Hypercapnic means excess carbon dioxide is accumulated in the lungs. Okay, so we can't administer excess oxygen to the patient, only limited volume. What is 1 to 2 liter per minute oxygen is essential. It is an important topic for the question asking area. If it is saying that in the scenario the client is brought to the emergency department with breathing difficulty, and the primary management, they will administer to 6 liter oxygen, sometimes administer 4 liter oxygen, administer 1 to 2 liter oxygen. You should select one minimal oxygen supply should be needed for the COPD patient. All other conditions like even bronchial asthma and other lung conditions, we can administer more oxygen. Up to 6 liter can be administered. But here in case of COPD, we can administer only 1 to 2 liter per minute. Okay, and high Fowler's position, that what will happen, the client will sit upright, so the diaphragm will goes down, the thoracic cavity get expanded, the client vocal breathing get controlled. Okay, that means it will ease the breathing capacity of the patient. Next one, short acting beta agonist for the acute relief. Acute relief means here the main reason for the breathing difficulty is the bronchospasm. The short acting beta agonist action is to relieve the bronchospasm, so immediately client will get the relief from the dyspnea or the breathing difficulty. To treat the inflammation, we can administer IV steroids. If there is a bacterial infection is suspected, we can administer antibiotic. Okay, that is after the that is ruling out the sputum culture, what microorganism is present in the mucus. After that, we can start the administration of the antibiotic. And adequate hydration is essential, because here in case of COPD there is excess mucus production. By administering or by maintaining the hydration status, this thick tenacious sputum get loosened by administering an adequate fluid. Okay, otherwise the secretion will get sticky. Okay, to loosen the secretion, here the client need adequate hydration. So what are the main management for acute exacerbation? Have high Fowler's position, oxygen 1 to 2 liter per minute, short acting beta agonist, example albuterol. Okay, then IV steroids, antibiotic if infection is suspected, and adequate fluid intake or hydration. And in a normal COPD patient, that means COPD is not an acute condition, it is a chronic condition. That means from the years and years the client is suffering with the breathing difficulty and because of the bronchospasm. There is multiple episodes of acute exacerbation can noted in the patient history. Okay, here in a COPD patient, after as a management, lifetime management, we can give health education about the smoking cessation. If the client is having a habit of smoking, we should tell the patient to quit smoking. Okay, that is to prevent the further occurrence of the acute exacerbation and to maintain the bronchus in a normal way. Okay, next one, we can recommend the client for taking inhalers, that is long acting beta agonist. Okay, and salbutamol also we can recommend for this patient. Then pulmonary rehabilitation, that means here we community visit also there. That means to assess the respiratory clearance of the patient, we can here teach the spirometer, and we can tell them about the personal breathing, like that. Some pulmonary rehabilitation programs are there. We can give health education about the pulmonary rehabilitation, and also we can tell the patient to take dose of vaccines, especially pneumococcal and flu vaccines, because here there is a complication. COPD complication is pneumonia. Okay, so the main causative organism for pneumonia is the streptococcus pneumonia. Okay, if the client have vaccinated with the pneumococcal vaccination, the risk for developing pneumonia can be minimized. Understood? So we should recommend. These are very important points. I have taken only important points only. You need to at least remember all these things. Okay, next one, nutrition and exercise. The client need to take adequate nutritional diet. Also the client need to do some exercise, minimal exercise. Okay, and energy can here the because of this increased work of breathing, the client will always look fatigued and low energy. So here we need to give health education to take adequate nutritious diet, as well as involve in minimal exercise programs and also energy conservation programs. Okay, these are the main management for the COPD. And here how we need to give care to a patient with COPD. The main thing is nursing process or at P. A means assessment, D means diagnosis, P means planning, I means intervention, E means evaluation. That means in assessment, what are the things we have to assess? We should look for the respiratory stats. That means we should check the respiratory rate. The normal adult respiratory level is 16 to 20 breaths per minute. Okay, if the client is having increased work of breathing or respiratory problem or will struggle with breathing, the respiratory rate will get increases greater than 20 breaths per minute. Okay, here the saturation level is also low, but here that's because of the hypoxia. Acceptable saturation in a patient COPD 88 to 92% is the acceptable saturation. Not all these points should be noted somewhere. Okay, normal respiratory rate is 16 to 20 breaths per minute. Normal adult saturation is 95 to 100%, but here only in case of COPD 88 to 92% oxygen saturation is acceptable one. Okay, and while analyzing the ABG, we should look for respiratory acidosis. How we can assess the respiratory acidosis? Acidosis means we can look for the pH. If the pH is low, that is acidosis. pH is higher, it is alkalosis. How can differentiate respiratory? By looking the value of the PaCO2. That means partial pressure of the carbon dioxide. If there is a retention of the carbon dioxide or accumulation of the carbon dioxide, increased partial pressure of carbon dioxide occurs in case of the acidosis. Okay, and if the partial pressure of carbon dioxide decreases, it is causes in case of the alkalosis. And the breath sounds. While assessing the breath sounds using a stethoscope or auscultation, we can hear the wheezing because of the mucus trapped in the alveolar spaces. Okay, these are the main assessment findings in a patient with the COPD. What are they? Respiratory rate, saturation, that means the oxygen saturation level in the blood, arterial blood gas analysis, pH, partial pressure of carbon dioxide, and the breath sounds like wheezing. Okay, and how we can diagnose the patient? That means that is because here the exchange, normal gaseous exchange got interrupted because of the bronchospasm. So here is impaired gaseous exchange is the nursing diagnosis. And what is our primary goal for a patient with COPD? Acute exacerbation or it's a stable COPD. In acute exacerbation, our primary goal is to relieve the client from what? Hypoxia. Here the client develops symptoms like dyspnea, that is because of the bronchospasm and because of the hypoxia. So we need to, our primary goal is to improve the oxygenation level in the blood in the patient. So we can administer oxygen 1 to 2 liter per minute. Oxygen administration is recommended, and normal expected saturation in a COPD patient is 88 to 92%. I am giving you the theory questions, all you need to involve. Okay, and next interventions. First one, pulmonary rehabilitation programs can give, and here can provide position, then spirometry. Okay, the spirometry exercise, administer bronchodilators. Bronchodilators means to dilate the, to relieve the patient from bronchospasm. For example, albuterol. Bronchodilators are two types of short acting and long acting. If it is acute exacerbation, we need to administer albuterol, that is a bronchodilator. And finally, we need to, how we can evaluate the condition of the patient? We can evaluate whether the oxygen saturation got improved. That if that means in expected oxygen saturation, COPD saturation is 88 to 92%. If the oxygen saturation is increased to this level, the SpO2 level got improved. Okay, and when there is a decreased dyspnea, that means the work of breathing got relieved in the patient. Likewise, we can evaluate in the client. These are the main management or nursing managements in the patient. What are they? Assessment, diagnosis, planning, intervention, and evaluations. Okay, so hope you got an overview or a refreshment of the COPD theory. Anyone have any doubt on the COPD? Because we are moving on to the question. Anyone? If anyone have any doubt, I can repeat it. Who is this one? This Nucleco. Hello. Can you please introduce yourself? Is it patience? No. Okay. I don't know. If you are not able to speak, can you please, okay, audible. This,
Okay.
okay, okay.
His name is Nkululeko.
What is it? Khuleloko. Okay, very good name.
Nkululeko.
Khuleleko.
Yes.
Thank you. Welcome,
Yeah.
Khuleleko. And can you please introduce yourself and where are you from and in which country you are planning to process? If it is able to speak, you can speak. Otherwise, you can message me later. Okay, no issues with that. Okay, then we can move on to the question analysis. See, this is our question. Actually, it is a nutshell question. Nutshell means short question only. That my main aim is to able to make you understand how to approach a question, how to analyze a question. You already know. You all are attended my classes and question analysis classes. So here in the case study question, the background information is the client name is Ramesh, Mr. Ramesh. He is 67-year-old male. Okay, he is a 67-year-old male. And what is the history of the patient? He has a history of 45 pack year smoking. Okay, that means in a year he used to smoke 45 pack of cigarettes. And also he is a chronic bronchitis patient. That means the history of bronchitis, chronic bronchitis, and also he has the history of hypertension. These are the background informations. Age is 67-year male patient, 45 pack of cigarettes he smokes in a year, and he is a non-case of chronic bronchitis as well as hypertension. These are the background information. What is the current complaint in the patient? The client is saying, I can't breathe properly, I am coughing a lot, but it is not coming out. That means the client have the tendency of to cough out, but it is not coming out. What it indicates that the client have a lot of secretions in the lungs, but it is sticky and it is hard, it is too difficult to come out. Okay, from it's already in the history it is said the client is having chronic bronchitis. Okay, bronchitis means inflammation of the bronchus. When there is a inflammation, according to the inflammatory changes, there is a production of the exudates can happen. Okay, so chronic bronchitis patient, there is a lot of secretions are there, but because of this bronchospasm, because of the inflammation and the mucus accumulation, indirectly we understood from the one term itself, the client is having chronic bronchitis. So there is two things are there. First thing, bronchospasm. Second thing, bronchospasm plus mucus production because of the inflammatory changes. Okay, so because of this reason only the client is struggling to breathe. So here the client is saying, I can't breathe properly, I am coughing a lot. That is because of the secretions only. The client is having severe cough, even he is trying to spit it out, it can't be possible for the client. These are the background informations. Next, what are the current symptoms? The client is complaining about what are the symptoms? Dyspnea at rest. That is because of the hypoxia. Even if the client is experiencing with difficulty in breathing at the rest, that indicates that there is a existing hypoxia. That means the deficient supply of the oxygen is present in the patient. Dyspnea at rest. Second, audible wheezing. Wheezing mainly it is a music vesicle sound while on auscultation. It is abnormal breath sound. That is mainly because of the mucus accumulation in the alveolar space. Okay, audible wheezing is there. Thick yellow sputum. That means the sputum is sticky as well as there is some infectious presence is there. So that only the color of the sputum is yellow. That is because of the exudate. Exudate means there is the response of the inflammatory changes, the client sputum is the color is turned into yellow. Okay, last one, using accessory muscles for the respiration. That means the client is struggling to breathe. Okay, These are the main current symptoms of the patient. In a case study, they will mention the client is brought to the emergency department with the dyspnea at rest, audible wheezing. While otherwise it is saying, the client says that I am not able to breathe and cough out properly, by assessment, while assessment, it is noticed that the client is having dyspnea at rest, audible wheezing present, the client complaining about the thick yellow sputum, and by observation we can see the client is using his accessory muscles for taking breath. Okay, so and last one, pursely breathing, that means because of the hypoxia the client is struggling to breathe or striving for the oxygen. Okay, pursely breathing, and he is anxious, that is because of the breathing difficulty, restless, that is because of the hypoxia. Okay, so all these symptoms are there in the patient. By seeing itself, we could understood that something is there. That means already client is a non-case of bronchitis. Okay, so here the client is having what, inflammation. So the client will have the cough with the productive cough. That means the presence of the secretions will be there. The client is struggling to breathe. Okay, struggling to breathe, and it is mentioned the client is using his accessory muscles for the respiration. And other important thing, restless. When in your case study you are seeing that there is a client is restless, always think about the hypoxia. Hypoxia means there is a low oxygen saturation level. Okay, that means because of the inadequate gaseous exchange, the client is struggling to breathe because of hypoxia. Okay, these are the underlying clinical manifestations. See, in the vital signs, temperature is 100.9 degree Fahrenheit, heart rate 112, respiration 34 minutes, BP 150 by minutes. Okay, here by assessing the vital signs, we understood that because of the inflammation. Okay, when there is a inflammatory changes happens in our body will respond it as a increasing the body temperature because of the increased metabolic rate. Okay, so here the client is having fever, that means up to 100 degree it is acceptable body temperature. If it is greater than 100 degree, it should be it should be looked, or it should be treated in the patient. Here that is all client is having inflammatory changes, so it is manifested as temperature 100.9 degree Fahrenheit. And here heart rate is 112 per minute. That means here already we understood that the client is struggling to breathe. Here the oxygen level is decreased. So what will happen? The client will struggle to breathe. Okay, so to maintain the oxygenation status, the heart will pump more blood to maintain the oxygen level, or to maintain the supply of the oxygen through the supply of the blood. So the client will experience tachycardia. That means normal adult the pulse rate is 60 to 100. Here the client is having tachycardia. Okay, respiratory rate also 34 per minute. What is the normal respiratory rate? Anyone? Normal adult respiratory rate, how much? I have mentioned previously. See, it is a question analysis. We should move on with the interactive classes. Please answer, otherwise it will be very boring. Normal respiratory rate, how much is the normal respiratory rate? Lydia, can you please tell me normal respiratory rate? 24 breaths per minute. It is not a exact amount. I have mentioned anyone, Rectimol, are you able to give me the answer? What is the normal respiratory rate? How much?
12 to 20.
Yes, 16 to 20 breaths per minute is the normal respiratory. Chicha, how how much you said?
I said 16 to 20.
16 to 20 only. Okay.
Yes.
Okay. Now, see, these are the basic vital signs. Okay. No, what is the normal heart rate? Normal adult heart rate?
60 to 100.
60 to 100. Okay, very good. Normal respiration? 16 to 20. And what is the normal BP, blood pressure?
122, 128.
Yes, 120 by 80. Okay, very good. Hi Vikas.
So good morning. How are you? Good
I'm
evening.
fine, I'm fine. And thank you for joining. Thank you so much.
Thank you.
Okay.
I got little bit. Today we had the PIC clinic,
Okay.
intravenous catheter clinic.
Okay. Okay.
Peripherally induced, introduced a central catheter.
Okay. Okay.
Mainly in chemotherapy patients, we do it for long-term access, almost 6 to 7 months, sometime
Okay.
six,
I
six
am
to
just giving a case study analysis, just completed COPD nutshell theory. Move on with the case study. Just we are, it is a
First of
starting
all,
only.
first of all, First
Yes.
of all, I want to congratulate you for your future journey and whatever you have achieved. It's commendable.
Yes. Thank you so much.
US is welcoming you for further opportunity and
Uh,
it will be opening a new era to you.
yes, yes. Thank you
So
so much. You
everybody,
also will get it soon. Okay, we are praying
everybody
so
will
much.
get go to
uh,
US.
yes, you also will get it. We can meet. Okay, we can meet there in USA. I believe, and I am praying so because I think almost 10 candidates are there. We are the first batch for our this MAPS program. Is it because it's
No,
a
no, second batch, I think, second batch.
second batch? Okay, I don't know. So whatever it is a great blessing for us, and everything is happened for good only, and hoping for the best. If we are completed our this program, and if any changes has happened for our life, it will be a great motivation for others also, for the future nurses
Yeah.
also.
So
So
you
that
can see how the man has struggled for this year's opportunity and finally she got it because of her dedication,
yes.
her knowledge, skill, and perseverance. So I ask you all to do the same hard work to the same level to with your aspiration. Study hard and follow
Okay.
her advice.
Yes, yes, thank
Okay,
you so
continue please.
much. No, I believe it's only God's miracle. I believe so because so many struggles went through my journey. Because even when I started the processing itself, even it's a step by step process. Okay, it is not happen in a 1 day, 2 day. Even the last 6 months, I struggled a lot because of so many documents. They will tell upload this, and the evaluations after in finally my travel to Hyderabad and Chennai, that is a commendable one. I don't know how much I struggled, but even now I'm so proud that here God made me to sit in front of you with a smiling face. That is because of God only. And I appreciate means all of your support and care because last 2 weeks I didn't even notice the classes. I didn't even enter even took any class or even sent a message. But all you means my friend and this Vikas and Sharon have managed the classes. My students have accepted me as, oh, I am so busy. No one has interrupted me. I thank you so much. I don't know. I can't express my happiness through my words. Like
We
it's
can
only
see here
God's
at your
miracle.
face. We
Yes.
can see at your face how much it's booming and how much you're happy.
Yes,
We
those who
can
are
see
sitting
there
here
again.
also, I
So
believe you got motivation from,
everybody
yes,
can do this.
yes,
She can do this.
anyone
He
can
has
do this. Actually,
shown the way. Yeah.
yes,
You have
really,
made
we
it.
want
Everybody can do
perseverance,
it.
consistency. That is the main thing. If we have a focus, we should move on. There so many struggles will come either from the family or from the profession or from the society. Whatever the struggles are coming, we need to fight it. Okay, and God will give a miracle way. What is our dream destination? We can reach soon, but to reach there, we have to went through some stations. So many stations are there. That all stations we can pass, and finally we can reach there. And to thank you so much once again. Okay. Thank you, Vikas, for the
Okay,
great
continue,
comment.
continue.
Okay. I am moving with the question. Thank you so much. Okay. Here it is in the wild case study analysis. The question. What is the main question here? I will recommend here in the scenario. a patient, his name is Ramesh, and his age is 67 years old. Okay, what is the history of the patient? The client smokes 45 packs of cigarette in a year. Also, he is a non-case of chronic bronchitis and hypertension. Okay, what are the chief complaints? The client is saying he can't breathe properly, and the client is struggling to cough it out the sputum, but it is not coming out. That is because of the sticky sputum. Okay, what are the current complaints? The client is complaining about the dyspnea at rest, and on auscultation got audible wheezing, and because of the accumulated mucus, the client got thick yellow sputum. The client is using accessory muscles for the respiration, and the client using pursed lip breathing and anxious restless. Okay, what are the vital signs? We have reached here the vital signs. What are the vital signs 10? The temperature is 100.9 degree Fahrenheit. That means that is because of the inflammatory changes the client developed fever. Okay, this, if it is up to 100 degree Fahrenheit, it is normal. If it is greater than 100 degree Fahrenheit, we should suspect for any infection in the patient. Okay. Also, when there is increased temperature, automatically our heart rate will get increases. Okay, so the client, and also here is existing hypoxia also. What will happen? The heart will try to pump more. Okay, so the heart rate will get increases. Tachycardia can be noticed in the patient. The respiratory rate, normal respiratory rate is 16 to 20 minutes, but here it is 34 per minute. That means the client's work of breathing is increases. Okay, so the respiratory rate is 34 breaths per minute, and normal blood pressure is 120 by 80 mm of Hg. But here already in the history it is mentioned that the client is a non-case of hypertension. Okay, so it is acceptable BP in a hypertensive patient, 150 by 90, and also as well as the client is struggling to breathe, so the BP will automatically get increases. Here BP is 150 by 90. Here the oxygen saturation is 86% in the room air. We know that in a COPD patient, the oxygen saturation level will be low because of the existing hypoxia. But here the acceptable oxygen saturation in a COPD patient is 88 to 92%. But here the client is having only 86%. That is a low saturation. That means here the client need oxygen support. Okay, all thing, whatever the conditions are you are reading, at the same time you have to think for the management also. Okay. So these are the current vital signs in the patient. By move on to the ABG result, you have to tell what is it is. Okay. Now here the client's pH is 7.30. Is it acidic or alkalotic? I will ask the question, that person will answer. Okay. Here Lydia, can you please tell me, is it acidic or is it alkalotic? The pH is 7.30. Please unmute for one.
Acidic.
Acidic. What is the normal pH level in our blood?
7.35 to 7.45.
Yes, very good. Thank you so much. Okay. Yes, our normal pH level is 7.35 to 7.45. Here the pH is 7.30, that is less than 7.35. Here the client is a acidosis. Okay. So next one, partial pressure of the carbon dioxide. It is 60 mm of Hg. Next one, I will ask, who is there? This what is Kukileko? Can you please answer? If able to answer, if able to speak, you can speak it out. If not able to speak also, no issue. Oh, I think she is on duty. Tichafara, can you please tell me what is the normal partial pressure of carbon dioxide, and what is in case of this patient, the particular given case study? Tichafra, where are you now? Have you gone?
He's on duty, I think. So
But he has responded previously. That's why
maybe
I asked.
busy.
Okay.
Lydia, can you answer, Lydia?
Lydia, you tell me.
Nukke Luleko Ndolu. You can also type also in the chat box.
Yes. Type in the chat box also if you are not able to. Actually, I want a response from this Kukuleko. Whether you are following the classes, anything I want to repeat. Can you please tell me? No. Lydia, can you please respond? What is the partial pressure of carbon dioxide level? What is the normal one? What is in the client condition? Whether it is respiratory acidosis or respiratory alkalosis, whether the value is increased or decreased. Can you please repeat?
PC, ma'am, normal it's 45 to 35.
35 to 45 normal. 35.
Yes.
Yes.
And it's alkalosis.
Yes. Alkalosis. The Nicoloko responded as, I will ask the partially compensated respiratory acidosis. No, my question is not related to compensation. Whether it is partial pressure of the carbon dioxide is increased, and your answer is correct. Okay, I feel so happy that you have responded. Here it is respiratory acidosis only. Why? Because the normal partial pressure of carbon dioxide is 35 to 45 mm of Hg. Okay, only value which is opposite journey is the carbon dioxide. Okay, when the carbon dioxide is increases, that is acidosis. When the carbon dioxide decreases, that is alkalosis. Okay, here in partial pressure of carbon dioxide 60 mm of Hg, that means it is greater than 45 mm of Hg. Okay, here it is alkalosis, not alkalosis. It is, Lydia, it is answer for you. It is not alkalosis, it is acidosis. Understood? Why? Because here accumulation of the carbon dioxide is happen. Okay, in the alveolar spaces, the carbon dioxide is not eliminated through the exhalation. Okay, here the client is struggling to breathe, so exchange of the oxygen and with the carbon dioxide is not taking place adequately, so which can lead to hypoxia as well as hypercapnia. Okay, here increased carbon dioxide level, so we can suspect for a, what will happen, the condition is respiratory acidosis. Here it is given bicarbonate also. Why? Because the answer Nicolaka is very correct, because here respiratory acidosis is compensated with the what? Alkalosis. That means the bicarbonate level is 22 to 26 is the normal value. Here, whatever in our body, if it is a respiratory acidosis, the compensatory mechanism with the alkalosis. Okay, if it is a alkalosis, the compensatory mechanism with the acidosis. Here what happened is that here the client is having what? Respiratory acidosis, which is compensated with the metabolic. Bicarbonate is related to the metabolic, always related to metabolic. So here value got increases greater than 26 milliequivalent per liter. That is the respiratory acidosis is not completely compensated. That means here pH is still low only. If it is pH is normal, that is between 7.35 to 7.45, we can say that it is a compensated respiratory acidosis with metabolic alkalosis. Okay, but here the pH is still low, that means it is a partially compensated. Okay, partially compensated metabolic respiratory acidosis with the metabolic alkalosis. The correct answer only. Thank you so much. Here the PaCO2 is 58 mm of Hg. Okay, that is very hypoxia, low level of oxygen level, because 95 to 100 is the normal level. And while assessing the chest X-ray, we can see the hyperinflated lung. The lung, the diameter, okay, the client will develop barrel chest. So, and because of the accumulation of the carbon dioxide also, we can see a hyperinflated lungs in the patient, and also flattened diaphragm. Okay, flattened diaphragm. And these are the main things we can see in the case study. And management order from the physician order is administer oxygen at 1 to 2 liter per minute via nasal cannula, start albuterol nebulizer and steroids, methyl prednisolone IV fluids, okay, and the sputum culture. We need to assess whether why we need to give oxygen 1 to 2 liter per minute. Here the oxygen saturation level is 86% only. So the client need here oxygen administration. So the physician's order is oxygen. Second thing, as a acute relief from the bronchospasm, here the client need a short acting beta agonist administration, that is albuterol nebulization. Then to control the inflammatory changes, we can administer IV steroids, that is methyl prednisolone. To maintain the hydration status, can administer IV fluids and the sputum culture to rule out the organisms which is present in the sputum or the mucus. Okay, these are the physician's order. And also antibiotic. It is given in the case study that the client is having thick yellow sputum. Okay, if it is a thick yellow sputum, that means suspected infection is there. So the client need administration of the antibiotic also. Okay, and also continuous pulse oximeter. That means we need to monitor. The client's oxygen saturation is 86% only. Here we need to administer oxygen with the 1 to 2 liter. After the administration of the oxygen, we need to continuously monitor, because our expected oxygen saturation is 88 to 92% in a COPD person. So we need to continuously monitor the oxygen saturation also. These are the background information of the case study in the patient. Okay, first we move on to the question. Okay, the first question is identifying worsening trend. We have already seen the vital signs trend in the patient. Okay, now what is the temperature, heart rate, BP, respiration, we have seen in the question. Here the question is, it's a SATA question, that means it is a select all that type question. We can select answer more than one. Okay, identify the worsening trends and which finding indicate the patient's COPD is worsening. That means patient COPD condition, the bronchitis condition is worsening. How we can notice? By assessing the vital signs itself. Actually, it is a incomplete means the vital signs trend should be 2 trends are there. It is not shown in the case study. However, we can move on to the options. Okay. Previously, respiratory rate was 28. Okay, when the patient brought to the ED, emergency department, at that time oxygen respiratory rate was 28, but current status it is 34 breaths per minute. Okay, so we should think whether the condition is improved or worsened. Okay, second, the oxygen saturation is dropped from 90, initially it was 90%, but now it reduced to 86%. Okay, you should have an answer with the question. Third one, patient becomes drowsy. That means the patient, when we feel drowsy, when our body get inadequate oxygenation or hypoxia, we will feel exhausted and drowsy. Okay, so the third one is the client feel drowsy. Next, sputum become thicker and yellow. That means the sputum became more sticky and more yellow. That means there is a purulent discharges because of the presence of microorganisms. Last one, pH improves from 7.30 to 7.38. Okay, by assessing all these options, you should tell me what are the current options which indicate the client condition has worsened. The question, you read the question twice. What is the question? Identify the worsening trend. Worsening trend means the client vital signs trend shows the worsening of the patient condition. So, if the vital signs level is becoming to normal, that means the client condition is improving. If the vital signs trend is diminishing or going into decreased level, that is the client's condition is getting worsening. Okay, so you have to keep in your mind about the normal values. We have to correlate with the scenario of the patient and we should select the correct answers. It is a select all that type question. This is SATA type question. Okay, what are the correct answers? What are the correct answers? Who are there here? Tichafra, Lydia, Teacher Afra, can you please tell me what are your answers? Others are also should tell me your answer. If you are able to send me message, you can message us A, B, E, like that. You can send messages also. Teacher Afra, you can tell me what are your answers.
Sorry, what is the question? I was attending to my client, so I didn't hear anything.
I'm not getting it. Is not clear. Your voice is not clear. What you are asking?
I'm saying I did hear the question. What is the question? Because I was attending to a client.
See, read the question. Read the question.
Okay.
Read it.
Okay. Which findings indicate the patient's COPD is worsening? Select
Yes.
all that apply.
Yes.
Respirations increases from 28 to 34. Yes, it's worsening. And then SpO2 drops from 90 to 86. Yes, it's also worsening. And patient becomes drowsy. Yes, it's also worsening. Maybe sputum becomes thick and more yellow.
Yes.
It's unexpected.
What are the options which indicate the client's COPD condition is getting worsened? Okay. The respiratory rate is increases from 28 to 34. What it indicates? Conditions improving or worsening?
Worsening.
Why?
Because the normal respirations is between 16 and 20. And the client is conditioned initially the respiration at 28, and it is now at 34, which is showing a sign of worsening.
Okay. Then second option.
SPO from 90 to 86. It's also worsening, but this is it's also worsening because a COPD O2 is supposed to be from 88.
What is the normal expected saturation in a COPD patient?
I think it's 88.
2?
88 to 92.
92%. But here, previously the oxygen saturation level was normal. Currently, the oxygen dropped into 86%. That means there is the hypoxia getting worsened. Okay. So, the condition got worsened. Option B. And what about option C?
Patients becomes drowsy. It's also worsening.
It's worsening, but that is because of the hypoxia. The cells are starving. Okay, cells are starving. That is because of the hypoxia. The client will feel drowsy. Okay, so next one. Sputum becomes thicker and more yellow. What it indicates?
I think it's an expected end because no, it's worsening. I thought it's the mucus. Yeah, it's worsening.
Why? Why it is worsening? Why you selected the correct one, but why it is worsening? How you selected that is because every option you should have. You are going to appear the exam in next month. Okay, so that only I am calling you. Every option, whenever you are approaching a option, always you should have a why question in your mind. Why question? Okay, why the respiratory rate increases from 28 to 34? Because the work of breathing get worsened. or that means the client is struggling, breathing difficulty getting worsened. Here oxygen saturation is 90 to 86%. That means the hypoxia getting worsened. Next one, because of hypoxia, client become drowsy and the sputum become more thicker. That means the sputum become thicker means sticky. That means there is a what more discharges are producing which is accumulated and became sticky, and there is more yellow color. That is the purulent discharges indicate the suspected infection also. There is a suspected pneumonia also. Okay. So the condition is getting worsened only. Okay. So last one, pH improves from 7.30 to 7.38. What it indicates?
Improvement.
Improvement. Here in acidic, from the acidic level to what, the pH level became normal. So it indicates that the client condition getting improving. So we can eliminate by using elimination method. What are the options you can eliminate?
The answers will be A, B, C, and D.
Which one?
A,
E
B,
will
C,
be
and D.
eliminate.
Yes, Lydia?
E will be eliminate, ma'am.
Yes, very good. E will be eliminated. And what are the correct answers?
A, B, C, and D.
Very good. Understood how we have approached the case study, how we have understood the case study condition, correlate with the vital signs, and by reading the, we have everything we have correlated with the case study background information, and we have correlated with each options, and the questions always you should read twice. Okay, what is the question? Identify the worsening trend. So here in vital signs trend we select that. What are the correct answers? A, B, C, D. Understood? Any doubt? Any doubt on have you felt any difficulty in analyzing this question? Lydia, Ticha.
No, ma'am.
Yeah, Nicolako,
I got it.
thank you so much. Have you got understood? Any doubt on this analysis of this question? First, we need to, thank you so much. First, we need to understand the scenario, understand the condition of the patient, symptoms, understand the vital signs, understand the doctor's order, everything. Okay, that will, it is a 6 series question. According to the each question, they will give the information. So always we should read, understand it. Thank you so much. Okay, so I hope you understood about the question analysis. Okay, so this is the way we need to approach a question. We need to understand a question, correlate with each option with the scenario, given scenario. Okay, so we can analyze one more question. See, all the rationale. Here increased respiratory rate, that means the work of breathing rate, increased the respiratory distress, falling of the SpO2, worsening of hypoxemia, that means the oxygen in the blood is getting decreases. Okay, drowsiness, that is carbon dioxide retention as well as the hypoxia. Okay, and thick yellow sputum, which that is because of the existing infection, and also the obstruction is getting worsened. That is only here the secretions will become sticky. Okay, is correct because here the pH is improving. That means the client ventilator status is getting improved. Okay, hope you understood about this question analysis. Second question, it is a ABG interpretation. Okay, already you have done it in previous question. Okay, then no need of this question. Next question, priority. Okay, priority question. What is the, which action is the priority? Okay, here the options of increase O2 to 6 liter per minute, encourage coughing, place the patient in a high follows position, give warm fluid. What is the primary action? Here the client is struggling to breathe. In the scenario we understood that the client is struggling to breathe. Okay, what is the correct priority of action? Can you please tell me?
Option C, ma'am.
What is place the patient in a high follows position? Lydia, why you have eliminated all other options? Tell me that also. Why you eliminated option A? Increase O2 to here the client has started oxygen 1 to 2 liter or in a nasal cannula. But here it is given the option increase O2 to 6 liter per minute. Is it recommended in a COPD patient 6 liter oxygen? Lydia? Is it recommended? 6 liter oxygen is recommended in a COPD patient? No. We can't increase the oxygen to the oxygen supply to a patient with COPD. Maximum what oxygen administration level is 2 liter. 1 to minimal oxygen support only needed, because here we need to maintain the oxygen saturation level 88 to 92 percentage only. No need to maintain a 100 saturation. Here the expected saturation, normal saturation in a COPD patient is 88 to 92 percentage. So here we can administer oxygen 1 to 2 liter per minute only. No 6 liters. So we can directly eliminate that option. Next, second thing, encourage coughing. Is it the primary priority of action? You respond please. All of you can respond. It is a interactive class. Question discussion, we can't move on with a monotonous voice. It should be the discussion one. Then only you will get clarified, understood about the question analysis. When you are doing the question by yourself, no, at that time this class will be very beneficial. How I analyze the question, how I make you to think. Okay, like that you can. So the correct answer, Lydia is saying option C. So yeah, last option, give warm fluid. Actually here only we can eliminate oxygen to 6 liter can eliminate. But here we can encourage coughing, place the client in a high Fowler's position, give warm fluid. All are recommended. Okay, but here the question is priority action. Priority means a client is struggling to breathe. For our primary priority is to ease the breathing. That means to decrease the workload of the breathing. So we need to provide a Fowler's position. That means the 90-degree position to the patient, so that while providing Fowler's position, the patient work of breathing can be minimized. How? The diaphragm will goes down and the thoracic cavity will get expanded. So the client struggling to breathe will get relieved, okay, or managed. So the correct answer here is option C, high Fowler's position. That means the positioning expanded the chest and for a primary management, okay, is the high Fowler's position to the patient. See here we can't recommend a high oxygen supply to the patient. That means already client is hypercapnic. If we are administering more oxygen, what will happen? The carbon dioxide level will get accumulated more, can lead to further hypercapnia. Okay. So next question, you should do it. Who will read and who will give me answer? From your side. I am not calling your name. Otherwise, you all three are there. Three can discuss and give me answer. Okay. So that your thinking level get improved. Okay. One can lead it. Who will? Tichafra, are you able to speak? Otherwise, all three can drop your answer into a chat message. Okay. Finally, I will call one to analyze that. You just drop your answers in a chat box. I will give you 1 minute. 2 minutes. Now it is 4:22. By 4:24, I should get the answer. Okay. You read the question, understand it, and you give me the answer. Okay. Send me the message. It is already time is out. Can you please send me the answer? Otherwise, you can tell me. No one has dropped the message, I think. Nikoleko, can you please explain? If it is wrong, also no issue. I just want to means confirm whether you have followed or not. Okay. So can you please tell me the answers? Nikoleko, Lydia, Ticha, anyone can give me the answer? I want from your side. Because question analysis is a different level, because here we need great means thinking, higher level of thinking. We should be able to understand first thing. Second thing, we should apply our critical thinking by correlating, by applying the theory in the clinical scenario. And the best method to easily understand the question is just visualize the scenario. We all are working in a hospital. We know that how a patient with a breathing difficulty. Okay, so how as a nurse, what are the things you can do for the patient? So such things you can just visualize it. You can do it. Okay. It is already over. No one has answered me. Lydia, tell me your answer. What is the question here? One has sent the answer. I will check it. Lydia given A and D. Okay. Others. Tichafra also give me the answer. Ticha and Nukuleko, can you please type your answers? See, I am sitting here for you only. Okay. So I am explaining for you only. It is the benefit of for you only. Okay. I want to make you to understand, clear understanding about the question analysis. I want answers from your side. Then only I can understood that are you following the analysis or theory, whatever it is. Okay. No one is there. Others. Nukuleko, can you please write the answer?
So it's A, B, D, and E.
You type it. You just type it, Shafra. A, B, D, and E.
Also, I'm driving with my client here, so.
Oh, okay. No issue. No issue. And next one, Nikoleko. Are you able to type it or speak it out? Time is going to end. That's why I'm asking. Only Lydia have given it. Next time, all of you please attend the case study analysis. Daily you will get the case study analysis. Okay. So please attend the classes. Actually today I have night duty, so that only I have selected this time. So don't worry. In coming days it will get resolved. Okay. No issues with that. Okay. Okay. I am moving with the analysis here. Lydia, are you able to speak? I want one person, because then only I can make it clarify you. Lydia, are you able to speak? Here, what is the question here? Lydia?
Yes, ma'am.
Yes. What is the question here? You just read it.
Question number 4 is set of questions. Expected provider order during COPD exhibition.
Yes.
Select all interventions you expect the provider to order.
Okay. What are the correct order? What are the? Yes.
Choose options A and options D, ma'am.
Option A and option D are your answers. Okay. So,
006.
what about the option B, IV corticosteroid? Is it needed for the client?
Yes, ma'am. Okay, yes. Again, options B also.
Oh. Now, your answer is already fixed. A and D. Okay. Next, we are analyzing each option. you have not analyzed, not even given a mild thinking with the options, then so that only you have selected two options, option A and option D. Okay, already I have explained the theory. I explained the theory with the question, then I move on with the question I given for you. Okay, so here the client is having COPD exacerbation. Okay, so what are the interventions expected to provide to the patient? First thing, albuterol nebulizer. Why we are administering albuterol nebulizer? It is a short acting beta 2 agonist. So to get an immediate relief from the breathing difficulty, the client need to administer what albuterol nebulizer. So that is correct one. The second option, IV corticosteroid. Is it need to administer corticosteroid? Yes. Here the client, why the bronchospasm occurred here? That is because of the inflammation. Okay, so here to manage the inflammatory changes, here the client need IV corticosteroids. Third one, high flow oxygen to keep the saturation at 99 to 100%. Here the client is having COPD exacerbation. Is it need to maintain the saturation 99 to 100, Lydia? Is it need?
No, ma'am. 88.
Yes, normal expected saturation 88 to 92%, and the maximum 1 to 2 liter oxygen can be recommended for a COPD patient. So we can eliminate option C. Okay. So next one, IV antibiotics. Is it needed, IV antibiotics? Is it needed? Lydia? What about the secretions consistency of the patient? In this case study scenario, we have got that the client secretion become sticky and more yellow. Okay, that means there is a suspected infection. Understood? So here already the client has ordered with the ceftriaxone injection. So IV antibiotics needed or not? Give me answers please. Anyone? Otherwise it's too boring. Lydia? Yes, needed. Antibiotic is needed. Very good. And next option, pursely breathing instruction. Is it needed? Just type it, yes or no. Pursely breathing is recommended in a COPD patient?
Yes.
Needed. Is it? Okay. So option D also correct one. E also correct one. Last one, sedatives for anxiety. Is it recommended?
No.
Why?
It will further cause mental distress.
Okay, it will further cause the hypercapnia can get what increases, the client will go into respiratory arrest. Okay, so sedatives are not recommended for a hypercapnic patient. Okay, so here the interventions are mainly, what are the correct interventions? Administer albuterol nebulizer, IV corticosteroid, IV antibiotic, pursely breathing. Okay, these are the correct options. Teacher, for how many marks you got? Out of four. Out of four.
Four.
Total 4 you got. Okay. Lydia got 2. Why? Because she has selected 2 right answers. Thank God she has not selected wrong answers. So the no negative marks are there. Usually for the SATA question negative marks are there. But here she has selected 2 correct answers. So she got 2 marks. Ticha got selected 4 correct answers, though you got 4 marks. Understood? Actually this is the way we need to analyze the question. No need to fear about the question, no need to panic with the question. Just we need to understand the scenario. For understanding it, we should get a theory. Okay, so that only we are providing all the theory classes. You try to attend your maximum. Yes, Lydia got 2 marks. Congratulations to both of you. Okay, thank you for your responses also. Thank you for attending. Okay, I know all are working in this at this time, but I don't have any other options. That's why I selected this time. However, you have attended both, and one more student has, but I don't know Nukaleko. I don't know her. But anyway, she is also a good student. Okay. Okay. Whatever. How you feel, Teacher Farah? After a long time, you are attending my classes. Okay. How you feel? Whether we are move on to the last previous classes vibe or not? Anything you want to add up? Is it okay for you?
So far, so good.
Okay, thank you, Teacher Afra. Thank you so much. So daily it is a exam based case study analysis. Okay, for the November it will go in a study mode only, but December for those who are taking exam in December, that will be too tight. Okay, it was a great one. Thank you, thank you, Lydia. Thank you so much. Likewise, you have to respond to others' class also, especially Vikas sir and the Sharon man. Actually, I am trying to complete the syllabus because we need to know about the familiarize with the theory. Then only we can move on with the question analysis. Without theory, we can't move on with the question analysis. So you try to attend the classes maximum. At least one person's class you try to attend it. Okay. So if you have any missed classes are there, you can watch the recorded video. Okay. Those who have a long time exam month, you have time. But those who are limited, teacher you have limited time only. So try to attend both classes maximum and maximum question practices. And after this case study analysis, teacher has to do the question by using Naxlex. No, you should send me the score. Okay, teacher Fra, are you miss?
Yes, I'll send you.
Yes, after this case study analysis, you have to analyze whether any change has happened to you or not. Because I am giving you the case study analysis even in one topic. The method you can apply it in every question analysis. That only my means what aim. You have to make the question analysis in a easy way. That will become your hard work into productive way. You should apply smart work. Hard work means how many time you are sitting for your study, but smart work is how you are utilizing your study in an effective way. Okay, spending a lot of time, that doesn't mean that it is a good hard work. No, I don't believe so. Even you are spending 1 hour for your studies and question analysis, you have to spend it in a productive way. That means maximum questions you have to take some new things from each questions. Okay, if you are doing so, you can crack this exam very easily. No need to fear about this exam. You are my because your result are my my stepping, but what your past result I need to get so that I can get more students. So you have to put yourself and your hard work, smart work. If you have any doubt, you can ask to us. Anyone can ask to us. If you want to ask to me, you can ask to me also. Actually, I am too much busy, so that only I am not getting time to message you. But soon I will get much time to message you, so don't worry about. But I want a past result from you all. Those who are attending my classes, I want a past result. How we can get a past result? We have to apply our theory in the question analysis in a correct way. Critical thinking, clinical judgment, following all the criteria, how we can prioritize the needs of the patient, how we can eliminate the wrong answers, how we can rearrange the order, how we can delegate the correct duties to the person, like that. Actually, if you have a clarity about all the theory, your question, whatever the question from different areas are getting, you can attend the question very easy way. Okay, so best of luck. Time is already running up 10 minutes. Thank you for attending. If you have any, I will send the PDF also. One more case study and some more questions are there. You just go through it, and one question you try to do by yourself without answer question. You try to do yourself, and if you have any doubt you can ask to me. Okay, nice to meet you all once again. Tomorrow we can meet. Time I will tell you because I have night duties mostly this time only for these 3 days. After that we can change our timing according to your convenience. Okay, thank you so much. Okay, thank you for joining.
Thank you, ma'am.
Okay, bye. Okay, bye.
Thank you.
Thank you. And you, both of you, please write your review on the class itself about the case study analysis so that others also get motivated. They will spare time for attending classes. Okay? Teacher Fra Lydia, can you please do that? 1 to 2 sentences.
Okay, ma'am.
Okay. Thank you so much. Thank you so much.
Thank you.
Okay, bye.
Di tapete di usare di Januari.